Good afternoon. Just a quick housekeeping item before we get into the crux of it all. The BMV, the Bureau of Motor Vehicles, this week started by appointment only in-person transactions for those needing CDL or restricted agriculture CDLs on Monday. They've been processing those. There's 34 that have been completed already with over 200 more appointments that are set for this week. They're doing what they can to make sure that the drivers can stay on the road and keep our shelves stocked. With that, I'll get right to it and turn it over to Dr. Box for an update on cases and testing.
Thank you, Governor. Good afternoon. I have a couple of quick updates, and then I'll be back around to talk a little bit more about long-term care facilities. But I wanted to give a couple of good news items today. Number one, Indiana received 15 Abbott, what we call point-of-care testing machines for COVID-19, which means that we will be able to test in a period of about 15 to 30 minutes an individual. Unfortunately, we only got 5 cartridges with it, so we can test about 124 people, and a lot of that at first will go toward testing so that we can verify that people have been checked out on the machine. Abbott has said that they will give us regular cartridges going forward in the future, so we're looking forward to being able to use these going forward. So more to come on that. The second thing is we're very excited to show you some scenes today of the testing that is going on in Lake County. We are at Maryville High School here. The Indiana State Department of Health has actually partnered with the Lake County Health Department there, and we are testing individuals who are symptomatic from our long-term care workers, from our first responders, from our healthcare providers, and from individuals that work in essential services. I talked to the team about noon, and I was very excited to find out that they had already tested 120 people and that it was going very smoothly. So more to come on that later this week as far as other testing sites that we hope to have up and running. Governor?
Thank you, Dr. Box. Yesterday I signed an executive order allowing hopefully encouraging retired EMS personnel to return to service, to get back in the game, if you will. And I've asked Dr. Kaufman if you would speak to, we have this whole healthcare continuum, or from start to stop. And could you just elaborate on what's going on as these different dots are connected?
Yeah. Thank you, Governor. Hi, I'm Dr. Michael Kaufman, State EMS Medical Director with the Indiana Department of Homeland Security. And let me first say a special thank you to all of our frontline healthcare and public safety professionals who risk their lives every day. You are making a big difference. You've heard me say before that EMS stands very firmly at the intersection of public safety, public health, and healthcare. This novel virus really presents a unique challenge to everyone in public safety who finds themselves caring for both symptomatic as well as asymptomatic individuals. While all of our public safety personnel and professionals are equally important during this time, our EMS providers play a pivotal role in responding to requests for assistance, triaging patients, providing emergency medical treatment and transport for ill persons. However, unlike the care that's provided in a controlled environment of a healthcare facility, care and transport by EMS presents a really unique challenge because of the nature of the setting, being enclosed in an ambulance, the need for rapid medical decision-making, and interventions with limited information. I want to assure everyone that our EMS system will be there for you when you have a medical emergency. Our main goal in response and planning is to keep the EMS system operational for day-to-day emergencies, while at the same time allocating and directing resources to also assure that COVID-19 patients can be cared for and transported to appropriate destinations. In recent days, you've heard a great deal about our healthcare system surge plan. At its core, that surge plan works to build additional capacity within the healthcare system until such a time that patients coming into the healthcare system equilibrates with patients exiting the healthcare system. EMS plays a pivotal role on both sides of that equation. The Department of Homeland Security has been working tirelessly to assure that our EMS system remains operational to support the healthcare system throughout the state of Indiana. To date, our EMS division has waived more than 13 different rules in an attempt to help meet those system demands, and the governor's executive orders to date have also worked to help us achieve those goals. When and if you need to call 911, we continue to ask for public assistance by providing as much details as you can to your condition. Specifically, we're asking you to report information such as fever, cough, or other respiratory illness symptoms. Likewise, we ask you to meet first responders in an easy-to-access open space when your condition allows, or when outside conditions allow, to minimize exposure to first responders and to maximize air ventilation. Many EMS responders have implemented additional protocols to better delineate who needs treatment and transport to local emergency departments or other alternate destinations. Some patients will not need transport at all. EMS is going to make every attempt to get you to your hospital destination of choice. But as part of a regional surge response plan, active destination routing of ambulances by regional operations centers may direct you to an acute care hospital that can more appropriately care for your condition. We're aware that some EMS professionals, law enforcement, and public safety personnel in our fire departments have tested positive for the coronavirus. Their health and safety are of the greatest concern to the governor, Director Cox, and all of us at the Indiana Department of Homeland Security. To date, however, this has affected less than 1% of our public safety workforce. We are encouraged that through expanded testing with the Indiana State Department of Health, Eli Lilly, the Marion County Health Department, IU Health, and others, more public safety personnel are able to be appropriately tested and, when deemed healthy, can return to work in a timely manner. EMS and all public safety personnel are resilient and will press on until the job is done, no matter the effort needed. As of today, 75% of our EMS provider agencies are showing adequate PPE levels in either a green or yellow category. That means that they have what they need to care for you should you have an emergency. Conservation and preservation measures have been implemented to ensure a minimum standard level is maintained and help keep the wheels rolling should we need to assist you when you call for help. In order to better serve our healthcare system and keep patients moving to help achieve that equilibrium that I spoke of earlier, we have partnered with the Indiana National Guard to help move stable patients to step-down units, alternate care sites, or even discharge to home when the time allows. This partnership creates a network of additional transport assets spread across different preparedness districts in the state that can respond and assist in patient movement should our traditional EMS system become strained. You may see these National Guard assets, or FLAs, field litter ambulances, on our Indiana highways and roads over the next several days. Don't be alarmed. We're thankful for the Indiana National Guard and the assistance that they bring to this disaster response. These are just a few things that we have done to help keep Hoosiers safe during this time of uncertainty. And likewise, we're doing everything we can to keep our entire first responder community healthy so that we can ensure a consistent level of response for all types of requests for public assistance. So thank you.
Thank you, Dr. Kaufman. I've also asked Dr. Siniak, or Dr. Dan, as many know him, to discuss our long care facilities and what's going on in the infection control world and our strike teams. But we'll first turn it back over to Dr. Bach so you can finish your opening report.
Thank you, Governor. My comments are going to be very brief today, but I want to take a minute to emphasize the manner in which we have approached trying to protect our most vulnerable population here in the state of Indiana. That includes residents of our nursing homes, long-term care facilities, our residential facilities. Knowing that both the Indiana State Department of Health through regulation and the Family and Social Services Administration through the reimbursement for these facilities, that we are both very actively engaged with that. At the very beginning, Dr. Jen Sullivan and I decided to appoint one physician to oversee or be the executive director of our interaction, our communication, and our guidance that would go out to our long-term care and our residential facilities. That individual is Dr. Dan Rosiniak, and you'll be hearing from him in just a minute. He is the Chief Medical Officer at FSSA. But before I turn this over to Dan, I want to take a minute to share some data that our team has been able to extract with regards to our infections in our long-term care facilities and the deaths that have occurred. We know that Indiana has 735 nursing homes and standalone residential facilities with an estimated 65,000 Hoosiers that reside in these facilities. As of this morning, our strike teams have engaged with nearly 200 facilities and have tested nearly 600 people. And this includes residents of long-term care facilities, residential facilities, group homes, and correctional facilities. Of those tested, 191 came back positive, with nearly 170 of those being among our long-term care residents. More than a dozen positive cases have occurred in group homes, with the rest being in correctional facilities. Unfortunately, as you know, we've already seen 31 deaths among residents of our 12 long-term care facilities. This represents 15% of the 203 deaths that have now occurred in our state. We know that there will be more cases, so today I will be issuing an order requiring that directors of long-term care facilities, residential facilities, jails, prisons, or any congregate setting must report to their local health department and to the Indiana State Department of Health within 24 hours if you have a known or suspected case of COVID-19 in your facility, if you have an individual who dies of COVID-19 or a suspected case of COVID-19, or an employee who tests positive for COVID-19. This includes your employees, and that's very important. We provided a checklist very early on to all of our facilities, emphasizing the importance of not only reporting this to your local and to your state public health officials, but making sure that your residents and their families were notified about the positive cases or deaths that occurred. I've also had significant concerns about local decisions that are being made to try to prohibit the transfer of patients regardless of their COVID-19 infection. Our goal at the State Department of Health and at the state level is to work with, in collaboration and partnership, all of our local communities, all of our local long-term care facilities, and our hospital systems and medical providers in these communities so that we make sure that this most vulnerable population gets the best possible care in the best possible location. And now it's my pleasure to introduce Dr. Dan.
Hi, thank you, Dr. Box. Before I talk about the steps that we've taken to protect Hoosiers in long-term care facilities, I want to first discuss a little bit about how these outbreaks occur. If you think about it, the very nature of the facilities we're talking about is to provide a close-knit community, a place where someone who might need help with daily activities or managing their medical condition can receive that care and support, and also can socialize with others in the facility. In many ways, these become extended families to these individuals. But it also means that within these facilities, Hoosiers, who are the most vulnerable to this virus, are congregated together. Now, the best way to keep COVID out of a long-term care facility was to initially severely restrict those who potentially had the illness from entering. And this is why on March 13th, CMS recommended and we endorsed that no visitors should come into the facilities, that they should not have communal dining or communal activities, and that all of these facilities should screen everyone who entered for signs and symptoms of COVID-19. It also included restricting any worker who had symptoms or a worker who had direct contact with somebody who was known to have COVID-19. As this pandemic has progressed, however, we have learned that there is an increased likelihood of asymptomatic spread within the community. This is why, in addition to providing guidance to facilities on infection control practices since the beginning of the epidemic, on March 17th, Dr. Box also provided guidance on how to protect the workers. This disease creates the potential for a perfect storm in a long-term care facility. Large groups of vulnerable people living together and a highly transmissible virus that may not cause symptoms in those who care for them. Now, we have put together a comprehensive preparedness plan, and early on, we reached out to every facility, and by the end of the week of March 27th, had hand-delivered this guidance to all of our nursing homes and freestanding long-term care sites. This plan outlines in detail the steps that these facilities can take to try to prevent COVID-19 and to manage it when it occurs. The state also obtained federal waivers early on, and we did so to encourage and to empower long-term care facilities to act swiftly in pursuing resident and healthcare worker protections. We've worked with our long-term partners to temporarily waive numerous regulations. Now, in addition to trying to stop outbreaks from starting, we also knew that we would need a way to quickly slow these when they began. And this is where our strike teams come in. What started in 2017 as a way to slow hepatitis outbreaks was quickly adopted to respond to COVID-19. Now, you've previously heard Dr. Box talk about our strike teams, but I realize you may not know what they are and what they do. From the very beginning, this has been an agency-wide initiative. The strike team involves multiple divisions in the health department. Divisions like the lead, immunizations, environmental health, food protection, and the Division of Nutrition and Physical Activities. Each strike team consists of a coordinator, a nurse surveyor, an infection control expert, and an epidemiologist. And when we hear about a facility where either a resident or a provider is thought to have symptoms, the strike team is activated. These teams go in waves. The first wave is to go into the facility and to test all the residents and staff that are thought to be ill. We will also drop off needed PPE and do an initial assessment of the readiness for implementing the facility's COVID-19 plan. To ensure that the tests that we do are available as soon as possible, we have our own State Department of Health lab dedicated to running them, and this allows us to get the results back in 12 to 24 hours. The second wave will begin if positive cases are confirmed. First, we call the facility to let them know the results. Then we have our nurse surveyors assess, often in person, the plan the facility has put in place. We also have our infection control specialists call the facility to go over their infection control practices. And this can include doing in-person training of how to properly put on and take off PPE, as well as reviewing the facility's environmental plans to protect those who care for COVID-19 patients from coming in contact with those who don't. Now, to help with this, we have partnered with a local company, Probari. This is a team comprised of a geriatric physician and nurses working closely with us to do additional follow-up education and training. The third wave occurs if additional cases are identified in a new area of the facility. And in those facilities where there are multiple deaths, we will often go back numerous times to assist them in mitigating the spread of COVID-19. As Dr. Box mentioned, since we began our strike teams on March 17th, we've made nearly 200 visits and tested more than 600 residents and staff. We have rapidly expanded to having 11 teams covering the entire state and are adding more teams. We have a team now in every one of our 10 preparedness districts and an additional team that can be called upon for all the unplanned requests that inevitably occur during the day. While early on, we were limiting testing to just those residents and staff with symptoms, we are, as we increase our capacity, working on plans to test other residents who may, because of their proximity to another resident who has COVID-19 or a caregiver, to be able to test them as well. This would get us to where we would have a better idea of those who might be asymptomatic and who live in proximity to those who are symptomatic. If there's one thing I think we've learned through this pandemic, it's that addressing COVID-19 requires partnerships. And this is why we work closely with both the long-term care providers and the hospitals to make sure that transitions between them are done in a way that addresses the patient's needs and the ability of both facilities to safely care for them. As the state approaches the coming surge, it may also be necessary to expand the capacity of our nursing homes and skilled facilities to care for patients coming out of the hospital with COVID-19. This is why we are working with the long-term care facilities to implement the federal recommendations to establish COVID-19 dedicated facilities. This would allow a long-term care facility in collaboration with the health department and local hospitals to be a location to care for people with COVID-19 who no longer require acute hospital care but are not well enough to go back home or to a previous long-term care facility. Now, these are just some of what we have done. There is still more that we have to do. And as we learn more about how this virus changes, we will have to be nimble and change how we respond to it. What we will not change, however, is our commitment to doing whatever we can to protect those who live and work in the long-term care facilities, because they're our parents, our siblings, neighbors, sons, daughters, and friends. They are a family, and we'll do everything we can to help family. Thank you.
Thank you, Dr. Dan. And let me just say on behalf of every single frontline healthcare worker in the state of Indiana and really on behalf of their families who are not seeing a lot of them lately, let me just say thank you to everyone that is practicing good physical distancing procedures and practices over these last few weeks and remaining hunkered down, only tending to what is essential in life right now. It's helping us keep people safe, and it's helping us keep people that you know and love and people that you don't safe. We know a little bit about basketball here in the state of Indiana, and I would say we're in the first quarter, just in the first quarter of this game. And we are well conducted. We have a great team spread out across the whole state of Indiana. We each know our roles, and we each have a role. So you cannot let up, obviously, before we get through this and on the other side. We got to be just as intense about our practices today and tomorrow and next week, and it's going to make a difference. I know I sound like a skipping record at times, but I am not crying wolf. This is, we see the numbers, you hear the numbers, we report, we're very transparent about the lay of the land. We watch what's happening to our east and to our west. We are prepared as a people to get through this. And I just want to say I thank you. And to have our healthcare workers, the folks that are on that front lines, that are doing extraordinary work day in and day out, do it for them. Take extra steps for them. They want to get home to their families too. And when you look at how they are over-delivering, and I'm talking about our medics, I'm talking about our firefighters, I'm talking about our police, I'm talking about EMS from the first point till someone is fully recovered and back home in their loved one's arms. These folks, community after community after community, are stepping up. And I will say that tonight in South Bend, just to pull out a few examples, the area police and fire departments are doing a lights parade around local hospitals. A chaplain will say a prayer for those who are tending to those who are in need, and there will be given a round of applause out for all the medical staff who, again, sometimes we throw words around loosely, like you're working tirelessly. These folks they are the definition of tirelessness. And I just want to make sure that when these folks up in South Bend are distributing and passing out groceries to families at a drive-through, because they don't have time to go to the grocery, because they're making time for people who are in need. We need to lift those folks up in South Bend. In Madison County, the sheriff's office is delivering meals to the homebound. Firefighters went to area hospitals just to say thank you, just so folks knew that they were still connected to their community fabric and that there were folks who were there for them. There's been virtual tours of firehouses and reading to children all throughout our firehouses in the state of Indiana. In Carmel, firefighters are delivering rolls of toilet paper to hospitals for healthcare workers who, once again, don't have time to go to the store and purchase it because they're doing back-to-back-to-back shifts, and they don't want to let go. They want to see something through, including people's lives. In Clark County, school resource sheriff's deputies have been helping at food pantries since early on and providing curbside lunch pickups at schools. In Lake County, first responders and a restaurant have teamed up to create an Adopt a Nurse program, again, to feed our healthcare workers. So far, they've fed over 800 healthcare workers. So go Lake County. Not to be outdone, in Owen County, sheriff deputies down there, just outside of Bloomington, for a reference point, They have made sure that food is also getting directly to families. They're bagging groceries, and they're taking food to those very families in need. This is not something that was ever written in a job description as part of your primary or collateral duties. This is stuff that's being added on right now. They're still doing their job, but they're also making those connections to people who are in need. Companies like such as Louisville and Indiana Railroad are prepaying for hundreds of dollars for meals for first responders and healthcare workers in Jackson County and Bartholomew County and Johnson counties. Plainfield firefighters made cards for residents at an assisted living facility. You think about it, I have a good image in my mind of firefighters sitting around doing, coloring, and then taking it to residents to cheer them up, to just, burn the message that we are here for you, always. In Center Grove, Express Restorations, today, they brought a mobile sanitizing trailer to the White River Township Fire Department so that they could sanitize their gear and inside their ambulances. Again, making sure that they're safe. This is like a community coming together. Cardinal Spirits in Bloomington actually has produced over 10,000 gallons of hand sanitizer for emergency responders since very early on. They were right out of the gate from the very beginning, pouring it on. They've been doing it for around the state for those who are in need, for this critical, practicing good hygiene. And I'll just end with, because our program went a little longer, so Rachel will jump right into the questions so we can play a little catch-up, speaking of in basketball analogies. But from Captain John Melling of the Fishers Fire Department, I'm going to quote him. He said, "For all the madness this pandemic has wrought, it has also brought out a deeper humanity and empathy than the likes most have seen in their lifetime. It is an honor serving a community such as Fishers in a state which not only touts Hoosier hospitality, but also lives it." And I don't think it could be better said than Captain John. So with that, we'll go right to the questions.
Whitney Downard, CNHI.
Good afternoon, Whitney.
Good afternoon. My question is actually going to be for, and I apologize for this mispronunciation.
Dr. Dan.
Yeah. In Davies County, a private nursing home operator did try to dedicate a specific facility to COVID-19 patients, but received pushback from county health officials and an injunction. What's the role of the state when it comes to coordinating care like this, especially when two parties are disagreeing about how to go about providing that care?
Yeah, that's a good question. We right now are getting ready to release some guidance for long-term care facilities and how they would go about becoming a dedicated unit. And within that is really the key for communication and partnership. I think for this to work best, you need to have the long-term care facility that's partnered with the local hospital and with the health department. That way, the hospital knows if there's going to be a facility that has dedicated COVID-19 and whether they have the capacity to manage folks who are ill. And in return, that hospital will know where to send folks who are no longer requiring care, but still might be under transmission-based precautions. So our role really right now has been, can we create the guidance and can we create the outline for how it ought to be done and for what the best practices are?
Elizabeth, PBS Michiana.
Hello, Elizabeth. Good afternoon.
Hello, Governor. Some volunteers in South Bend arrived for their regular food pantry delivery duties today and learned that their services were no longer needed because the National Guard had taken over these responsibilities. The volunteer I spoke to was very pleased to see the Guard soldiers providing this service to the community, but was concerned that they were not wearing masks or gloves when he saw them. What is being done to protect Guard members from exposure to the virus?
Great question, and the General is on deck.
Hi, I'm Brigadier General Dale Isles, the Adjutant General for the Indiana National Guard. And to your question about protective equipment for the National Guard soldiers, we just received guidance from the Secretary of Defense that we were to start masking. Before that, we were trying to maintain physical distance in accordance with the CDC regulation. So what we're doing now is we are getting masks from the local economy, as well as fabricating masks on our own in order to outfit our soldiers with the masks. There is absolutely a need for volunteers to help, and I will certainly look into any volunteer that was turned away at that site, because that is absolutely what we don't want to do. We encourage volunteerism, and we certainly support that in our endeavor at each food pantry.
Thank you, General. There is a need, and we want our Hoosiers to continue to pour it on. We got to. We're not stalling here or running in four corners. We are pouring it on.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Afternoon, Governor. How are you?
Fantastic. Thank you.
This is for Dr. Box. Correct me if I'm wrong, but the other day you said that Indiana has actually tested fewer people per 100,000 residents than all of our neighboring states. So I wanted to ask, one, why are we trailing our neighboring states in testing? And two, do you ever see a point that Indiana will get to where anyone who wants a test can get one?
I think those are good questions. I think that we've been, we have struggled with resources to be able to do enough tests. Now we have the capacity to do more testing, and I think I showed that the other day pretty clearly. We can run about 3,700 tests per day. So we're really trying to remove any restrictions for people as far as testing anybody who's symptomatic. We're also trying to make sure that we get out and test in some communities where we know that there is a higher risk just based on looking at our numbers. Like in our southwestern and southeastern part of the state and up in the Lake County area, so that we can make sure, just like here in Marion County, and we're having drive-through testing, that we can identify further symptomatic individuals that are positive for COVID-19.
Steve, KPC Media.
Hello, Steve.
Good afternoon, Governor.
Good afternoon.
Let me try to cram in two quick ones. First one for you, Governor. One thing that's been circulating a lot on social media that we've seen is this New York Times map that showed where people are or aren't traveling less, and Indiana appeared to have some pretty good marks. So I wanted to get your reaction to just how people have been adapting to the stay-at-home and just your opinion of the job that they've done. And then quickly for Dr. Box, I know every case is different, but I wanted to know, is there kind of a typical recovery time if somebody is admitted to a hospital with COVID-19? Do we have like a 7 or 10 days or kind of an expected time window that it would take for somebody, assuming that things go well, to get better and then be discharged?
You want to go first, and then I'll
Sure.
go.
So we have not been able to look at our data specifically here in Indiana for that, but we do know that individuals that go into the hospital with COVID-19 may spend an average of 2 to 4 days in the ICU, and then provided they continue to do better, they can be out of the hospital within a 7 to 10 day window. In talking with individuals that have recovered, even those individuals that did not need to go in the hospital, this has really taken them a long time to recuperate. They may not still be infective, but they've just talked about having significant coughing and significant issues with feeling like they just they're not able to take quite that deep a breath as they used to be able to do, and that it has really knocked them for a loop, as I would say. I would also say that there are individuals that are in the hospital and in the ICU for very long periods of time, up to 2 to 3 weeks, but fortunately that's not most of our cases.
Yeah, and Steve, I would salute all those Hoosiers who have made a lot of sacrifices to date. I'd salute them on a job well done, but I would say that our job is not done, far from it, and we got to keep our head down and grind this thing out day after day after day. I know how hard it is, but it's making a difference, and there's no shortcut. You can't outsmart this invisible enemy. I likened it to a World War III against COVID-19, but in a traditional war, you know who the enemy is, you can find it, you can address it, you can allocate resources. This is something that what we know works best is physical distancing. That's how we will mitigate. That's how we will flatten the curve and make sure that our healthcare system doesn't collapse on itself, that we can continue to provide care. We have the capacity right now. That's the good news. What we also know as realists is the wave is coming, And when you look at the numbers don't lie. They are what they are. And so this is, again, I mean, not to just dwell or be obsessed with basketball analogies, but we got 3.5 more quarters to go. And so we're going to have to dig deep, but we have each other, and together we're going to get through it. Proud of Hoosiers so far.
Julia, Wish TV.
Hello, Julia.
Good afternoon, Governor. We appreciate you taking the time to do this every day.
Thank you.
I'm wondering about the state's definition of essential business, specifically construction. There are aspects of construction-related work that can make distancing guidelines difficult to follow. Do you believe all types of construction work are truly critical during a pandemic, and can you explain why?
Yeah. I do, and Sharon is taking the podium right now in our general counsel's office.
For construction sites?
Yeah, she's asking, is all of it, and where do we draw the line, and how did we arrive at a decision to say this is and this isn't regarding construction?
Well, it's always a balance. And again, I'm Sharon Jackson. I'm Deputy General Counsel to the Governor. It is a balance to keep Hoosiers at work, keep things going on as normal, but do it as safely as possible. And that is what we have said in the executive orders that the Governor has issued, is that do it safely. Follow the CDC guidelines, follow the State Health Department guidelines, and do your work safely, and you can. And so those businesses out there that are keeping our infrastructure there, that are providing necessities of life and the like, need to continue so that we can continue as a state. We can't have our roads crumbling, we can't have bridges falling down, and so we ask all employers and employees out there to do their work, but do it safely. Wear masks, wear gloves, stay 6 feet apart, and the like.
Thank you, Sharon. And we're holding ourselves accountable, as Sharon alluded to, just articulated that, whether it's building roads or bridges, I would invite the press corps to go out and see them do their jobs, because they are practicing physical distancing. And on jobs that we can't do safely, we have hit pause as well.
Marcus Green, WDRB Louisville.
Hello, Marcus. Good afternoon.
Hello, Governor. I have a question for Dr. Kaufman. Dr. Kaufman, you had said that 75% of EMS providers say they have adequate PPE levels. Can you describe whether that's spread out evenly across the state or in certain parts of the state, and what is the plan to increase that? That does seem, that appears that 25% of EMS providers say they don't have adequate gear for the work they're being asked to do.
Sure. That's a great question. Even those 25% who are listing themselves in the red category still have adequate PPE to provide patient care should a call come tomorrow. Most of those EMS provider agencies have their normal ordering process that they can still go through, and they're still getting PPE. It's just at somewhat more of a delayed fashion. For those that are running critically low and at risk of having to shutter their operations or at least temporarily suspend them, working with Department of Homeland Security, we've been able to reach out to Department of Health and get them adequate PPE so that they can maintain operations and still respond when someone calls for help.
Thank you,
Lindsay
Marcus.
Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
I think that's an excellent question. I think that the only way we're going to really know how many people in the state of Indiana were infected, because we were somewhat limited, as you know, on the ability to test individuals, is going to be able to test those antibodies, test those IgG antibodies in an after type effect. So I know that testing is already up and running in some places. I think that there will be more of that widespread and available in the coming months. It really doesn't help us right now for the acute illness. It doesn't really give us any good information. But in the long run, to know what individuals going forward have some immunity and can potentially work without fear or concerns with EMS or in our hospital or our long-term care facilities, that will be very valuable.
Rob Burgess, Wabash Plain Dealer.
The streak is alive, Rob.
Wouldn't miss it, absolutely.
Thank you for joining us again.
Absolutely.
We appreciate it.
Governor, just from a messaging standpoint, do you find that it's harder to communicate to the public given the nature of this crisis? I was thinking about after 9/11, how we were told about go on with your lives or the terrorists win. Well, it's like the best thing to do now is literally nothing. Meanwhile, some people who aren't feeling sick are spreading the virus without knowing it. And if we do everything right, in retrospect, this will all seem like overreaction. So I just kind of wanted your opinion on that.
Well, anybody that knows me knows that I don't like sitting behind a desk, and knows that I like staying in perpetual motion, knows that I like being connected on a personal level on the ground in all 92 counties. Like we talked about yesterday with the community crossing grants, we'd normally be out, we'd be in multiple counties for all of this week. But you play the hand you're dealt, just like everybody else. And this hour, this week, this month, the next foreseeable future is going to require us all to do things differently. Fortunately, we're blessed in the state of Indiana to have seen such generosity, such charity, such pulling together, such unification that I won't say it makes the job easy, but it certainly makes it a lot easier. And it's because thousands of people. You're going to hear more about this on Friday, so I don't want to make the sale right now. But we've had, in terms of, Dr. Kaufman just talked about PPE and was asked about what that 75%, 25% means. You're going to hear about this more Friday when our Secretary of Commerce, Jim Schellinger, and Chris Johnston talk to you a little bit about the budget and the economic side of what's going on right now. But we have had about 278,000 pieces of PPE donated to our effort. And we've made purchases as well. So we've created during the storm, pipelines, our own strategic state stockpile. And so with any blip or interruption or annoyance of not being able to get out the message in ways that were yesterday, I'm fine with that and feel good as long as folks are staying connected however they are, whether it's through radio or TV or newspaper, print. We have to make sure that from a local, state, and federal level that this continues to be a joint effort. And that's why I think that we're going to get through this maybe quicker than some, and why it's going to be so important on the other side. Just like in 2008, 2009, we went through a recession. We got through that. We carried on the plan of the day in a smart fashion. And because of that fact, we were first out. And we became a very attractive date, so to speak. And good times follow. The same is upon us right now. And we've never had a better team assembled. Thanks.
Cameron Riddle, WRTV.
Hello, Cameron. Good afternoon.
Hi, good afternoon, everybody. Just a quick question for Dr. Box. I think last week you said we would start seeing numbers sent out twice a day or more than once a day. When is that going to start?
Numbers sent out twice a day for, I'm sorry, for what?
There you go. There I am. I'm back. Updating the dashboard more than once a day for as far as our coronavirus numbers. Is that?
I'm sorry, I do not remember saying that. There hasn't been any intention to do that. We'll continue to update once a day at 10 a.m. those numbers. I do have more data that will be coming out later this week with regards to race and ethnicity, and we are gathering more data about individuals that have come into the hospital and then been released, and so basically have been getting better, and individuals that do get sicker in the hospital, but that's to come. I'm sorry if I misled you on that.
And we'll continue to have more data as we're able to share it as time goes by, and we have a more global picture and not singular focused on an individual. We'll be able to provide more and more information.
Jeff Smith, WLFI.
Hello, Jeff.
Good afternoon again, Governor. Thank you for taking my question. I'm wondering if there's any consideration being taken at the state level regarding providing hazard pay for healthcare workers. If so, what that would look like, what healthcare workers would be included in that potentially.
Yeah, more to follow. We're tracking very closely what's being discussed in Washington, D.C. in the congressional packages that are coming through. I know that's being bantered around. I have always said I'm not going to take anything off the table at this early juncture, but we are very appreciative of what's happening in Washington, D.C. right now, and we are postured to put those resources to work as soon as they get here. I was on the phone with Secretary Mnuchin earlier this week, and one target date is April 24th for us to have some funding that's coming into place. Very appreciative of the SBA loans that are already making their way into some of our banks, and so our small businesses can keep hired or rehire their employees. Again, you'll hear more about this Friday, but this is very important for Indiana, for our small businesses to continue to employ their workers right now. So when we do come out of this, their team, their experienced team is already in place on the ground, not waiting. We're going to need people to be at work as this pent-up appetite to do business again starts to roll out. So in terms of payroll, in terms of business loans, in terms of unemployment benefits, we're laser focused on all of this and working with our congressional delegation right now.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Nice to be back. I had to sit out you guys yesterday, so it was painful, believe you me. So good to have you all here. Governor, this is for you and Dr. Box. Two things. When you look at what Indiana has done so far, staying in place as Google has shown, also some of the other national data, it looks like maybe fewer than 900 deaths of COVID for the IMHC when it's all done. Extra hospital beds. You can see, but like you said, it is sort of the first quarter. Basically, sort of early numbers, you see the state maybe have to take any sort of extreme, extraordinary measures down the road, like shutting down entire cities, communities. That's number one. And number two, hearing stories in the African American community about people concerned about wearing masks. They may try to go into a store and with things such as racial profiling and other, unfortunately, stereotypical behavior they're worried about getting stopped or pulled over and not being able to participate in our economy simply because they are African American and wearing a mask.
We're all Hoosiers here. I have zero tolerance for that. There'll be no profiling on my watch. Secondly, you might speak about where we are, but we look at a lot of numbers, Abdul, obviously. I look at, the doctor will correct me, but I look at the whole continuum, the whole process of who's going into the hospital, why they're going, where they are when they're in the hospital, and when they leave the hospital, and where they go from there. And that's how the global picture that I'm looking at, of course, we're being very granular and we're looking at the trends and tracking. But I don't foresee right now, and the way we avoid those extreme measures, that you gave a couple of them, there are others out there. But I said this yesterday when you were taking a break, Abdul, but the way we avoid those extreme measures or practices is by doing what we're doing right now. Physical distancing, good hygiene, etc. What Sharon just mentioned, those practices. That's how I hope we never get to multiple field hospitals. We will if we need to. But as long as we're doing everything we have control of, hopefully we avoid all these. Not, we'll have the courage to go there if we need to.
You know, Dr. Kaufman shows me on a regular basis what it looks like with regards to our EMS runs, and although we have seen them gradually rising, they're still continuing to plateau, right, Michael?
That's correct, Dr. Box. People are listening, and they're doing the right thing. There are far fewer traumas and car crashes and day-to-day emergencies than we've seen before. Our EMS volume has gone down, but maintained fairly constant at this point in time, as I would say our volume in our emergency departments has been. So the message is clear. People are doing what they're supposed to do.
That plays out when we look at the percentage of our ICU beds that are taken up each day and the percentage of ventilators that are taken up each day. Now, that being said, that doesn't mean that we don't expect to still see a surge and that we're not preparing for that. And General Lyles has been very, very engaged and involved in that so that we will have alternative care sites that we know will be up and ready if need be going forward.
You touched on a very passionate issue with us all, Abdul. It's all about capacity here, and we've got it right now. We aim to keep it.
Sherry, the Indianapolis Star.
Exactly.
Hello, Sherry. Good afternoon.
Mic check, mic check.
Hello,
Testing,
Governor.
1, 2,
Hello,
3.
Dr. Fox. My first question is actually for Dr. Rusniak. Is that correct, sir? Thank
take
you.
it.
So my question, I have a question about nursing home staffing ratios, which are pretty low in our state compared to other states. I'm wondering how that impacts our nursing homes' abilities to do correct infection control. And I have a question for Dr. Box, just about how, as we learn more about potential asymptomatic individuals out there and how many of them there may be, as well as the potential for false negative tests, how does that shape your approach to handling this? Thank you both for being here.
Sure, I can answer first. Staffing in our long-term care facilities is, we know, challenging during this pandemic, similar to staffing in a hospital, because they're the frontline workers, because early on in this pandemic, we didn't know there was asymptomatic folks that were in the community. However, one of the ways that we prepared for this early on was to waive a lot of the requirements that long-term care nursing homes and other skilled nursing facilities have for hiring, specifically allowing different levels of providers to provide different services, to allow providers to come in from out of state and other places throughout the state so that they could keep their staffing capacities. From now, a lot of the long-term care facilities are large corporations and have been able to move staffing around. We continue to work with them and we continue to talk with them weekly so that if we find out that there is a critical problem in staffing, we will always look to partner and try to find ways that we can help them to maintain the adequate staffing ratio to care for the patients.
Can you repeat your question again? I was so engaged with Dr. Dan. He was doing such a good job, I completely forgot it.
Sorry, I had to go and mute myself again. Thank you. But my question was just about, as we're learning more about the percentage of asymptomatic individuals in the population, as well as false negatives, how does that shape the approach that you're taking going forward?
Well, you know, when we started this whole process, there was even a question of whether asymptomatic spread occurred. Could someone who is positive for COVID-19 actually have no symptoms and spread it? Pretty early on, we saw some cases as we were doing contact tracing that made us believe that it could occur. I think as time has gone on and there's some new literature out, when we look at the number of individuals that a single person can infect, that is a lot higher than what we actually thought it would be. And when you add in asymptomatic spread, it becomes sometimes just overwhelming thinking about how in the world you can actually prevent this. So the goal behind people staying home is that we don't have to know whether you are positive and asymptomatic. We don't have to know whether you're in the early part of your infection and just not realizing it's not your allergies but something else. We just know that you're staying home with your nuclear family and not infecting everyone else. And I think that's why CDC has gone to this. If you're going outside for your run, you don't necessarily have to have your mask on, but if you're going to the grocery store, or you need to go to the post office, or you need to go to the pharmacy, put your mask on, because that way you don't inadvertently infect something on a surface or with someone that's a little bit too close to you. So I think they're excellent questions, and it is certainly, the more we learn about this virus, the trickier it has been to try to address it.
Kevin Rader, WTHR.
Good afternoon, Kevin.
Good afternoon, Governor and Dr. Box. I would like to ask a question of Dr. Box, if we may. What are we doing to make sure that the COVID-19 death figures are accurate? And in this, I mean, say if someone were to pass or die at home, are those numbers counted?
Right, if someone passes or dies at home, and if they were COVID-19 positive, then we know, and it'll be included. If they pass or die at home and it's suspicious for COVID-19, someone in their home already had COVID-19, we would call that COVID-19. If they just pass and no one really knows what they died from, that's where our coroners are coming into play. And we've worked very closely with them. And just as I mentioned the other day with our drug epidemic, if someone died from unclear reasons, we automatically do drug screens. In this situation, we'll automatically do post-mortem tests for COVID-19.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor, and thanks for doing this again. And good afternoon, Dr. Box. This question is for both of you. As we get through this crisis, as we navigate it, do you think that it's important that Indiana increases its spending on public health in general? A recent report in 2018 by the United Health Foundation found that we were 49th in public health spending. Do we need to make some long-term investments there, especially if the coronavirus becomes a seasonal issue, particularly before we even have a vaccine?
The answer is yes. Dr. Box, do you want to elaborate? Clearly, the answer was yes before this, and a lot of the world will be different come next year or next month. And we'll continue to address, as we have across the board, whether it's infant mortality. We'll take on every tough issue there is, but we're going to be in a reconstruction phase coming out of this. This is the toughest thing that, dare I say, any of us in our lifetimes have dealt with or probably ever will again. But what the lessons that we learn from this experience will, again, just as we came out of 2008, 2009, those tough times, and we started to do things differently, we were better off for it at the end of the day. We were stronger for it at the end of the day. And of course, in terms of our health, this is putting a spotlight on, Dr. Box said a couple days ago, that our diabetic and our obesity and all those rates that are adversely affecting those who are going into the hospital, the warning light is on. And so, yes, we'll put not just more attention, but there'll have to be more resources. Again, fortunately, and I want to express my gratitude to our congressional delegation, both sides of the aisle, for recognizing this right now and helping us triage this situation. But we're all going to have to look at this differently and take different actions in the future. So I have to agree with the governor, and you know, I'm a public health official, so of course I think more funding needs to be there. But what I will say is that our legislators and our governor have increased funding over the past 2 years and supported things with regards to infant and maternal mortality. We had a lot of great programs coming up for this next budget biennium 2 that we were looking forward to. But I think that when I look at this in the state of Indiana, to be able to improve our support for our local health departments across the state, and to be able to beef that up so that they are better able to respond and have the support that they need, and maybe have full-time health officers and full-time public health nurses that are there. I think that will set our communities better, because you know, we understand that there are some of our local health departments that can stand on their own and manage everything really without much help from the State Department of Health, and there are others that struggle to be able to do the basic things that they really want to do for their community. So I do hope that as an after action we sit down and really look at public health in the state of Indiana.
Our final question is Nikki Kelly from the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon, Governor. I was wondering if Dr. Box could explain how you determine if someone is fully recovered, negative on a test, and if you're at home and think you have COVID, how do you know when you're better?
Those are really good questions. And, you know, the CDC originally came out that in order for us to know that someone was recovered and could get back out in the community, we would have to go back and do testing 2 days in a row and do an oral and a nasal swab. If they were negative, go back the second day and do it. That became a very unrealistic thing to do when we saw the numbers of people that were infected and the limitations we have in testing. So with further evidence, they have said that basically you need to be a minimum of 7 days from your symptoms and a good 72 hours beyond when you have had any fever that you know, we're not using aspirin or Tylenol to bring it down, any cough or anything. So that's going to take you out beyond that 14-day window pretty much all the time. Whether there are other long-term effects on an individual's lungs, on an individual's cardiac or heart function, I think that remains to be seen, and I think we'll see lots of studies and information that come out about that in the future.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.